Welcome back. In this segment, we visited Omega Hospital, where we talked to a patient who had a horrible skiing accident. She was referred to Dr. Luis Espinoza, an orthopedic sports medicine surgeon who discusses his plan of treatment for 2 torn ACLs and MCLs. This is a really great story. Take a look.
Christmas Eve, I decided to go skiing in Whistler, British Columbia, and bit off a little more than I could chew and went way up at the top of the mountain and didn't make it quite down. I had a terrible skiing accident.
Dan came to me on a referral. When she showed up to the office, she was in a lot of pain, still limping around. And we ordered an MRI. While skiing out at Whistler, she ended up having a bad injury going full speed down the slopes. Was seen by the medical staff there, decided to fly back home to get her care.
Tore the ACLs, MCLs in both knees, meniscus cartilage damage, and fortunately found a fabulous doctor, Luis Espinoza, who was going to reconstruct the ACL that was torn from the femur on the left, and I'm not quite sure if we're reconstructing the other one or what he's doing with that one, and fix the MCLs and the meniscus cartilage. So I'm in good hands at Omega.
Omega is actually a multi-specialty surgery hospital. We do almost every kind of surgery here. We do GYN, general surgery, ENT, of course sports medicine, hand surgery, neurosurgery. We're real big in the breast reconstructive cases. So we do a wide variety and diverse realm of different types.
I'm very pleased. It's very homely. I feel very secure with my daughter having surgery here. In fact, I had surgery here a couple of years ago for my knee surgery, and it was wonderful. I'm very impressed.
When I saw her in the clinic, we suspected bilateral ACL injuries, which is pretty common to have on one side, to have on both. Extremely uncommon, but based on the mechanism, we ordered the scans, and sure enough, based on her clinical examination and based on the MRI findings, she had bilateral ACL tears from both knees. Okay. The ACL is going to be the main stabilizing ligament that controls rotation. So usually it's a non-contact injury. You land awkwardly or get hit, and then you feel a pop, have some swelling, a lot of pain, and what will result in is instability where the knee actually buckles out or gives way with any kind of rotating or twisting motions.
I had heard a lot of wonderful things about him, and when I went and had my consultation, he was my second doctor that I met, and we just connected. I just loved everything about him, his personality, his knowledge, the way he explained things to me. And, you know, just sometimes you find that doctor that you just trust, and it was him.
So today what we're going to do is take the athlete back. We're going to examine the knee once she's comfortably asleep under anesthesia, just confirming the clinical diagnosis, and then we're prepared to go in there. And since it's a ligament that once torn doesn't regenerate, doesn't heal itself, we'll have to arthroscopically slip in through little incisions, take out the torn ligament, and then reconstructing it using her own hamstring tendon, which grows back. Since they both tore, unfortunately it's not a ligament that's going to heal, so it's one that we're going to go ahead and just reconstruct using your own tissue.
I trust you.
So we'll keep our incision small. While I'm in there, I take a lot of pictures. I always print up a duplicate set so that when I see you tomorrow, I'll be able to review all that with you.
Okay.
You know, kind of explain exactly what we found, how I was able to fix it, the final result, and then you get to keep that set, and we'll go from there.
Oh my gosh, it's like a beautiful hotel. It's a beautiful boutique spa hospital is what I call it. And everyone is so efficient and so kind. And I mean, I've been treated like a queen over here. As I should be. But
Oh, it's lovely. It doesn't look like a hospital room. I've been a nurse for many years, and I've never encountered anything so lovely, homely. And I think my daughter will recuperate very well here.
I'm a little nervous. I always get nervous when you get under anesthesia, but I know it's going to be just fine. And I'm going to do my physical therapy at Dr. Espinoza's facility. So I'm in good hands.
At Orthopedic Center, I got my 2 partners. We do have in-house physical therapy. There's 3 therapists that work in 2 locations, Kenner and Metairie. And it gives the patients or the athletes that added convenience to basically do their therapy close to their treating physicians. So it's kind of a whole team concept. If any problems arise during the course of the therapy, then they can either reach me or one of Dr. Murphy or Dr. Lyons and ask us any questions to kind of keep things on pace. Again, since this is a little bit unusual with both being done, if you're not feeling quite up to it, we can kind of hold off. The goal is to get you moving early to avoid any stiffness.
Okay.
But it doesn't have to be like right then. You know, if you need to buy a couple days, that's okay.
All right.
Once she meets all our criteria and leaves comfortably from the hospital, she'll go home. We like to see all the patients back the day after surgery. If we try to explain anything or pictures the day of, a lot of times they're just too groggy, too uncomfortable, and then they won't really capture a lot of the information. So seeing them back the day after is great. It gives us a chance to make sure that they're comfortable, gives us a chance to review all the photographs, explain it, and then basically outline the whole therapy schedule that's going to follow from there.
I don't think I'm going to go snow skiing for a while, but I'm going to go to Costa Rica this summer and try to zip line. So I need to get my knees back in shape.
As long as there's no associated cartilage or meniscus damage, if it's pretty straightforward ACL reconstruction with a motivated patient and a good therapy team, then the results are 90% plus as far as returning back to sports, regaining the stability in the knee, the confidence in the knee, and the strength to be able to get back to jumping, twisting, and cutting type sports.